Drive to work with me as I talked to you a little bit about epinephrine. I had a question the other day that someone asked. They said, are there different receptors that are more activated at different doses for epinephrine, so like at high doses versus low doses? So the answer to that question is yes. At the low doses, so we use it a lot in my CVICU on post-op open heart patients. At low doses of like 0.02 to 0.05 mics per kilo per minute, you're going to see a lot more of the beta effects of this medication. So you're going to see the increased heart contractility, increased heart rate. You're going to see things like a little tiny bit of vasodilation and some bronchodilation, which are our beta receptor effects. As you get to higher doses, you start to see more of the alpha effects. So if you think about like in a code situation, if you push an amp of epinephrine, that's 1 milligram versus we're talking about mics per kilo per minute. And at 1 milligram, you're really getting most of the alpha effects. So higher doses, if you're titrating your epi drip up, as you go up, you're going to see in your patient more of the alpha receptor effects. And at the lower doses, you're going to see more of the beta receptor effects. So just have this information in your pocket. You're gonna be talking to your provider and going according to your policy. Knowing what you should expect is important. Just know that it's patient dependent. So it's not but have some empirical guidelines and it's like this is what we should always do. In epinephrine, it's not so black and white. We have to look at the whole hemodynamic picture for the patient. But if you have a patient hooked to a hemisphere or some type of flow track where you're getting their cardiac output and all of their SVR and all those hemodynamics, you can actually watch it on most of our patients. See those effects like we're talking about as you titrate your medication up and switch from a large amount of beta receptor effects to alpha receptor effects. If there's a pharmacist that wants to chime in, you definitely can. I'm definitely just a bedside nurse, but that's what I've seen. That's what the research from our research years ago said. And so that's what I see in practice.